Good morning and welcome to the Chamber of Commerce, Southern New Jersey's first virtual Health Issues Committee meeting. My name is Christina Renna and I'm President and CEO of the Chamber. It's my pleasure to welcome all who have joined us this morning. Thank you so much for being here. I'm extremely grateful to today's guest, our good friend Assemblyman Herb Conaway, for taking time out of his schedule to chat with us and take questions from our members amid the ongoing COVID-19 crisis. We'll be hearing from the Assemblyman momentarily, but I did want to thank him in advance for being with us. As always, before we begin, I would like to start by thanking our sponsors, starting with Horizon Blue Cross Blue Shield of New Jersey, who is the Chamber's Government Action Series sponsor. And of course, our Health Issues Committee sponsors, AmeriHealth New Jersey, Inspira Health Network, Ascenda Integrated Health, Fox Rothschild LLP, and We Work for Health. Thank you to all of you for your generous support of the Chamber's programming as we continue to navigate the COVID crisis organizationally for the betterment of our members and the entire regional business community. A few housekeeping items before we begin. In a moment, I'm going to turn our program over to Ward Sanders, who serves as the chair of the Chamber's Health Issues Committee and of course is the president of the New Jersey Association of Health Plans. After I turn the floor over to Ward will give some opening remarks and introduce Assemblyman Conaway. Keep in mind that all attendees today will be muted and the chat function will be open the entire time. So as the Assemblyman speaks, as Ward is speaking, feel free to type any questions you have for the Assemblyman in that chat function. We're going to try to get to as many of them as possible today. If at any time we end up running out of time or are unable to get to your questions, don't worry. We will make sure we get those questions to the Assemblyman and his staff and get you an answer in due time if we are not able to touch on all of the questions today. After Ward goes ahead and introduces the Assemblyman, he will give opening remarks. And then after opening remarks is when we'll move on to that Q&A period. With all of those housekeeping items out of the way, it is my pleasure to turn the Virtual Health Issues Committee over to our good friend and again, chair of our committee, Ward Sanders. Ward, the floor is yours.
Hi, good morning. Can you hear me okay?
Yep.
Okay, very good. I just want to make sure. Good morning, everyone. And as Christina has welcomed you, I will also joining her and welcome you to the first South Jersey Chamber Health Issues Committee. I hope all of you are well. We have great attendance. I think we have close to or maybe even over 100 people, not surprising given our guest today. Thank you for joining us here this morning. Again, this is our first virtual version of our meetings. We're happy to have Assemblyman Herb Conaway, who plans to discuss leading the Burlington County response to COVID-19, the measures that the legislature has taken to address the impact of the outbreak, and healthcare's move to telehealth. Assemblyman, we know how busy you are and appreciate you taking time out this morning to speak with us. With that, allow me to formally introduce Assemblyman Conaway. The Assemblyman is a graduate of Princeton University and Jefferson Medical School in Philadelphia, as well as the Rutgers School of Law. He has served as an elected member of the State Assembly since 1998 and is the longtime chair of the Assembly's Health Committee. He also serves as the Assembly Appropriations Committee and Assembly Science, Innovation, and Technology Committee. Like many of you, I have a second screen, so that's why my eyes are off to the left. And last year, the Burlington County Board of Freeholders appointed Assemblyman Conaway to take over leadership of the county health department. And prior to this appointment, he served as a doctor and professor at St. Francis Medical Center in Trenton for 13 years. As the Burlington County Director, Assemblyman Conaway has led the county's COVID-19 response and oversees the health department and its divisions, including Environmental Health Division, Medical Examiner's Office, Animal Shelter, Emergency Response, and Communicable Disease Programs. With that, please join me in welcoming Assemblyman Herb Conaway. The floor is yours, Herb.
Good morning, everyone. I hope that this time finds all of you healthy and hopefully not personally negatively impacted by the ravages of this disease. It's been a difficult time for our nation, as I don't need to tell anybody on this call, I'm sure. But in my own view is within the DNA of all of us, we have, we've had our family lineages suffered much more than we are suffering now with this disease, and we will get through this if we stick together and follow a coherent set of instructions and plans for how we move toward a new normal. I think in my view, before we get a vaccine which will work to prevent this virus from impacting the human species, that many of the things that we have come to see as normal will no longer be seen as normal. You may recall, if you've been watching the news, that it took us, the quickest vaccine we've been able to bring online was that for mumps, and that was a 4-year process. Now that was at the time using different technology, so hopefully that the healthcare leadership, particularly in Dr. Fauci and others, are right, and that this the time span to get to a virus or rather a vaccine for coronavirus is closer to 18 months rather than 4 years. So
Hi, everyone. We'd ask everyone to stand by as we work to get the Assemblyman's audio back. Please give us just a moment. Thank you for your patience. Thank you, everyone, for your patience. Just give us a minute or two and the Assemblyman will be right back with us.
oh, I think I was, hello?
Yep, you're back, Assemblyman.
Oh, I don't know. I don't know what. With respect to responses, the governor has been given, and others in the administration has been giving briefings on a daily basis as to the state response. The legislature has, we're getting used to trying to conduct our operations remotely. It is certainly one of the new normals is going to be a change in the way that we conduct group conversations and try to figure out an etiquette around the use of these telephonic communications and video communications. I guess video is better because at least you can see visual cues so that you know when maybe you're going too long, and I can't see any visual cues now. Perhaps you're already sending me those messages, but it is a challenge, but we'll get through it. We have managed to enact some legislation which we think is helpful. We've heard that we're probably going to have to do something on the debt and borrowing side to deal with this. As you know, the administration has, along with governors right across the country, have been petitioning the federal government for aid. Our budget is a mess, as you might expect, with economic activity being down, and we rely on that economic activity for a lot of the funding for the various programs that New Jerseyans want. And so filling that budget gap, keeping up with funding for schools and all the other needs, demands for public safety and infrastructure is going to be very difficult to accomplish without significant aid coming from the federal government. As you know, the governor has formed a very high-level committee to look at develop a process for reopening the New Jersey economy and building resiliency over time. As a frontline person here locally in Burlington County, certainly it is something that is on our task force management team, and the minds of our task force management team as well. We need to ramp up testing. will we have the supplies to be able to do that? Which is a question for us. We monitor our supplies of personal protective equipment on a daily basis, weekly basis, so that we can determine whether or not we can continue to gather specimens. We have to make sure that we have enough material to collect the specimens. We have to make sure we have the security personnel to manage the testing sites. So that's an ongoing challenge. We need to deal with questions of how our hospitals are operating and how we might have to change how care is delivered in respect to them. Luckily, in my conversations with them late last week and this week, our hospital situation in Burlington County appears to be pretty stable. We have seen flat, or in some cases, a slight downward trajectory in the number of admissions to the hospital. The ER is not at capacity in terms of what it needs to do. There is plenty of capacity of hospital space in Burlington County hospitals. And while the situation in other parts of Burlington County is not as favorable as ours is, that's the right word at the moment, we are concerned that we're not going to have the kind of numbers that we saw in North Jersey for a number of reasons, certainly population, but also because, as the wave started in North Jersey and controls were put in place, we benefited from that here in South Jersey. So while we are expecting to see some downward migration of this virus, and we're seeing across the country as it's left the East Coast and heading inland, we're seeing numbers rising in these sort of inland states. But we're not seeing that rise here yet in Burlington County. We hope that remains so. And nonetheless, based on advice we're getting from many quarters, and particularly from the federal government, it is important that we move toward a new normal with great prudence. If you look at past pandemics, if you look at the experience in other areas of the country where they have been less careful, we've seen a rise in COVID positivity and a commensurate rise in death rates. Now we're getting better at treating severe.
Hi, everyone. Please stand by. We're going to work with the Assemblyman to work on his audio connection one more time. Please hang tight. And again, thank you for your patience. Please continue to hang tight, everyone. In just a moment, we'll have the Assemblyman back.
Hello? Hello?
Hey, Assemblyman, we can hear you.
Oh, I don't know. Okay, I lost the okay, that I didn't know whether I was off or on. I mean,
Yeah, no, everyone can hear you. We just lost your picture, but we can certainly still hear you, so feel free to carry on.
oh, okay. Well, what I was going to say is there's going to be a push and pull between the idea that that some numbers of our people are going to have to sacrifice for economic good. I'm not in that. I don't count myself among that number. I don't think that we're not dealing with an existential threat from an invading power. This is a challenge, but I for one, am not prepared to throw people to the wolves, if you will, as we try to hit a new normal. I think we should be prudent in our return to normalcy, and the government stands ready to take an action to try to ameliorate the ravages of this challenge as best we're able with the wherewithal we have as a government. As I mentioned, our budget is severely strained, as anyone such as yourselves might expect. But hopefully, if we get the kind of relief that many states are demanding from the federal government, we'll be in better shape than we otherwise would. With that, I'm going to stop and sit patiently for questions, and say thank you for your attention and good luck as we move forward and standing down this crisis, and join with you and looking forward to better days.
Thank you, Assemblyman, and appreciate all those of you and for sticking with us here and the Assemblyman. Please, as a reminder, send in. Start my video. Sorry about that. Please send in your questions via chat, and I'll try to, as best I can, forward them to the Assemblyman. And while we're waiting for those, Assemblyman, I wonder if you talk a little bit about the state budget crunch. As the head of a county board of health, certainly local and county governments are also under a financial strain. I wonder if you could talk about challenges in funding there, and also a little bit about what you've seen as in your new role there, or somewhat new role, as how you think the state is doing and working with the various counties and trying to have a singular message, which I think you started off with as a important.
Well, it has put a strain on county budgets. These are budgetary problems we're seeing straight up and down. Local governments are concerned about the property tax payments to fund police forces, to fund the various operations of local government. The thought is that because of people are generally escrowing their mortgages, that this first payment should move forward pretty normally. But there's going to be concern about that second payment, property tax payment that's due this summer, and what things may need to be done to give people relief on that, whether that means spreading the payments or some other kind of relief is in discussion now, as I understand it. At the county level, we're impacted a couple of ways. There's concern about borrowing, low interest borrowing that the county generally does as part of its budgetary process. A lot of because we have bridges here in the county, and there's been an interplay between our bridge commission and supporting. I'm not a finance person, but it supports the borrowing that the government needs to do to deal with questions of payroll and other things going forward. With the decrease in economic activity, we have a decrease in the funds coming through the Bridge Commission that's often used to support countywide spending. So that has had an impact. As the state government looks to get support for its for the larger situations from the federal government, there is a hope, of course, that large S will trickle down or come down to the county and local governments as well. And we've had, as you might expect, to engage in unexpected spending. I mean, nobody budgets for having to go out and get get contracts. And luckily, we've changed. We have emergency contracting rules now in place, so that we're able to go out and make contracts to get testing supplies in, to get protective personal equipment in place, other things of an emergency nature that need to be acquired in order to deliver the kind of care that we need. We're going to have an issue in vaccines. Vaccines are not getting done because people are concerned about going into doctors' offices. And so if, depending on what happens with the school year, we know that a lot of kids right now are behind on the vaccinations, and a school year is coming. Now, whether that school year is going to proceed as normally or not, and I have my doubts, quite frankly, is a question. But I've got a plan as well on how to augment and help with the vaccine situation. So there are just a lot of unexpected spending. I think, as a state in the Northeast that's heavily impacted by this virus compared to other states, is sort of the border states, the California, Washington states. There's New York, New Jersey, the states in the Northeast corridor, down along the southern border, in the Midwest, of the Midwest. So you have, areas that are more heavily impacted than some of the more areas, parts of the country that are interior. But there are reports. I was looking at the New York Times briefly this morning, and we're seeing increasing, not unexpectedly increasing, of coronavirus positivity as you move toward the heartland. And again, not unexpected, but anyone who thinks we're out of this got more rosy colored glasses on than perhaps good. Yeah.
We're getting some good chat questions in here, and I'll read the names of the folks too. Hopefully that's okay. So Jerry Rothkopf said there have been problems with nursing homes, COVID-19. There appears to be COVID-19 has brought out how vulnerable nursing home residents are. Can you please address issues with nursing homes, specifically the tragedy with deaths among nursing home residents? Can you address what the state is currently doing, as well as how to protect these vulnerable seniors going forward?
Well, nursing homes account for, I should say, deaths in nursing homes account for about a third of the deaths. I think it's a little higher than that. You've seen reports of, or in some of these conjugate living situations, such as nursing homes, having nearly 100% of their persons positive for coronavirus. I suppose, given the vulnerability of those people, it's a reminder of just how resilient human beings are. As devastating as the virus is to those who have chronic conditions and are of an age, there are a number of people who are managing to get through this. Now, is that because of some resiliency that they have? It's certainly part of it. It may be the inoculum virus that they contacted, or other measures that have been taken to prevent, very serious illness and death in those persons. We also, by the way, there is a question of latency there. Well, we'll leave that to one side. As far as what the state is doing, we have in our county, and along with the state, we are monitoring the disease rates, COVID positivity in those institutions. They're required to report to us the number of residents who are coronavirus positive, as well as staff. That's collected and analyzed at the state level. Where there are particular problems, state inspectors are going in to look over procedures. And I would say, quite rightly, a month and a half ago, the time is sort of getting bent here a little bit in terms of exact timing, but admissions to nursing homes were curtailed. Visitation to nursing homes were curtailed. Many nursing homes, quite rightly, applied questionnaires to staff coming into their institutions, started taking temperatures of staff coming into institutions, shut down projects that might have brought vendors and other things into the institutions and carrying coronavirus into those institutions with them. So those things have certainly been protective, but it is just a huge hill to climb in dealing with a vulnerable population with chronic conditions, diabetes, heart failure, mobility issues, chronic lung disease. It's just highly vulnerable population, and how, and so no matter, really, in spite of what you do, you're going to see increased death rate among that population. One of the issues, and this is a long-term resiliency question, is that these nursing homes, really, many of them don't have the ability that you would like to see, and being able to cohort their patients. There are staffing issues. If the staff's not protected, and this is the PPE problem. If you can't protect the staff coming in, don't be surprised if that staff doesn't show up. And so you have, a smaller cohort of staff taking care of the same number of patients, or perhaps decline depending on how badly they've been hit by the disease, having to rely on more temporary help than usual, not having a place because of just the physical plant of the building to be able to cohort people, and then to be able to keep staff who are, say, working in a COVID cohort area in that area alone. So you have to keep staff there, equipment there. You don't want exchanges between your cohorted COVID patients and your non-COVID patients. So there are a lot of challenges, staffing, physical plant, PPE, that impact these institutions. The state has stepped up other inspections. I've been on calls with some of the administration of these institutions to inquire about their adherence to best practice and guidelines in this area. But a lot of this is just the age of the population, the physical plant of the buildings, and the lack of PPE. Whatever comes out of this disaster that we faced, we know that there have been important gaps in our sourcing and stockpiling of personal protective equipment. That is, whatever happens, that's got to be job 1, 2, and 3, and looking to the future that unfortunately is going to be marked by a pandemic of one size or another. So we had better make sure that we're doing a much better job on questions of PPE, ventilators, and the like, and have them prepared to be deployed at a moment's notice.
So more questions are coming in. Thank you for that. What's this? It's from Doug, and to sort of paraphrase, what's the status of testing in Burlington County? Is it available to everyone? How is it? Where is it being deployed, and so forth?
Well, in Burlington County, we still have, like most, really everywhere, we are concerned about shortages of personal protective equipment. As I said, there are 4 elements that we need to have in place before we can move forward with the testing. We have to have, make sure we have enough PPE to protect the people that we have to have staff. We have to have the PPE to protect that staff, including specimens. We have to have our security personnel, the 3rd element, to protect the site, to move people through the site. And we have always a backup ambulance or something like that available in case there's some issue with collecting the specimen or some other mishap on the site. So there are personnel and PPE and supply issues that we have to monitor and track as we move forward. And as should be a surprise to no one, all of those things are in limited supply. So we're marching through. We're able to keep pace with our 2 days a week now. We're shoot for 300 tests a day. We have relied heavily in Burlington County, and I imagine others as well, on advanced nursing students to come in and help with the collection. We train them on applying their personal protective equipment, how to get the specimens and label them. And they've been really, with our senior nurse leadership, very, they've been indispensable in getting our testing volumes where they are. Some of those student nurses have reached their clinical hours. We're retaining some of them, but people have got to get to work if they can. They have other responsibilities. So we're seeing some attrition. We're out with additional recruiting. We'll get some more people in. I would like to try to save money by not having to hire. Well, hopefully we can get enough nurse volunteers to come in, but a lot of our retired nurses have their own issues. And so, with chronic conditions. So we have to be, one of the issues with force augmentation broadly is having the personnel who themselves are not going to be and put themselves in serious jeopardy by coming back to work, particularly if the PPE is not adequate to protect them on the job. So we're moving forward, and we see any disruptions at this time. But the challenge for all of us, including Burlington County, is how we get more of these supplies in. Are we going to have testing at home? Now, part of the question, and I'll just end there because I know there are others, is whether or not we're going to continue to limit our testing to those who are symptomatic. As you know, CDC expanded their symptomatic, those things that qualify as symptoms. We're not that flush with any of those elements I mentioned, so that we would be in a position to move toward sort of a universal testing for anybody who wants it. We're not ready for that yet. And if we try to get there too early, we're going to leave a number of people who will most benefit from testing not able to get it. And I don't want to see that happen.
Right. This is a question from Connor Fennessy. Do you have, and this is looking a little bit beyond COVID, a sense of when the, say, the Assembly Health Committee would get together again to begin to take up non-COVID issues? Is this the sense in the Assembly when those non-COVID matters will come back for consideration?
Well, we are expecting to have a meeting later this month. The dates aren't, maybe Mitchell will text into me when a date's coming, but there are a few things that we are looking to. There's some concern for the relationship between hospitals and physicians that's come forward. There are mainly these the whistleblower. There are some whistleblower provisions that are of concern. We've heard reports of hospital administration really taking actions against persons who have pointed out deficiencies in the PPE area, and other safety concerns, which we're going to explore. We are, what's the other issue? There are restrictive covenants and things that we're looking at as well, and a few other items on a list of things. We'll see how much we can do. I mean, our hearings are, I guess, we're going to be brief, certainly more brief, because the public's not prepared, tuned into this remote this video questioning and the like. But we are going to take up an agenda where non-COVID items will be on that agenda.
Okay.
At this month.
Thank you for that. So this is a question from Elma Saravia. I hope I pronounced her name correctly.
Hi, Elma. Saravia. I can help you with that.
Your position on continuing social distancing and your opinion about when and how businesses should be reopened.
Well, and I'm fortunate to be appointed by the Speaker on our legislative committee, looking at sort of mirroring what the governor's doing with his, very high-level committee on how we transition to. I'm going to continue to call a new normal, because I think it's going to be quite some time before people are shaking hands and hugging in public, as so often and quite rightly for human species happens. I think that the social distancing measures are going to need to be maintained for some time, months, in my view. We are looking at a fall which will include a flu season, as well as many think circulating and perhaps higher circulating amounts of virus also in the fall and winter season, which are going to have impacts on obviously the amount of symptomatic illnesses in the community, as well as those who go into serious illness and even death coming in the fall. So if we are not careful about adhering to social distancing practices, we're going to have more people than run afoul of this disease than otherwise would. In terms of businesses, it's going to be and having a chance to look at plans that have been suggested by Rockefeller Foundation, and what Cuomo's doing in New York, and the things that the governor's thinking about. it's going to be a phased process. Businesses that have close contact, I think, are going to have to think very closely about how that's done. And you think about all those sort of personal services that people use that are sort of, I wouldn't say necessarily mainstay, but are just common in the business landscapes across the state, whether be nail salons, hair salons, barbershops, other personal services that are delivered, those selling homes, all those services that tend to bring people, that may bring people into close contact. How are those businesses? What should be the rules about those businesses coming together? I had an ad for plumbing services that came to the house by mail, and the advertiser pointed out how all of our people come into they come into the house clearly, but they are masked. They have been the temperature's been checked. We've undertaken a process to protect you as well as the people who are doing the work. Those kinds of measures are going to need to be taken by really all businesses. If you're selling donuts or cakes in a small shop someplace, in my view, there should be an insistence that people wear masks when they come to do that kind of shopping, and there should be limits on the number of people who can be in the store at one time in order to prevent, business is going to have to be conducted differently. And I think for some time, those businesses are able to do their business with people at home, I think would be advised to do that for the foreseeable future. If someone can work from home and you can monitor their productivity, then they should be allowed to do so. But this is me talking. This is obviously going to take a input from a lot of people, but it'll be phased. And as people return, they're going to return with, I'm going to say guidance, probably not to the force of law, without the force of law, but guidance on how best to conduct those operations while maintaining, some back pressure against the spread of this virus.
Keep your questions coming in. We do have time for a few more. And while we're waiting on the chat line, Assemblyman, there's a state website that you can go to that has information about hospitals on diversion that we've been tracking. And you can see it sort of.
I'm sorry, on diversion? On what? You broke up there a little bit. I didn't hear that.
Hospital diversion status.
Oh, hospital diversion. Mm-hmm.
You could see it over time is that, the northern hospitals were hit, and you could see it's kind of moving south. You said something earlier that, and I haven't seen anything in the south really hit. And you touched upon this a little bit, is that you've benefited in the south from your social distancing, practices that were led perhaps to get ahead of the curve a little bit. Is it also related to capacity based on the population down there, or can you speak to whether you expect diversion issues in South Jersey?
Well, it's going to be regional. I mean, if you look at the doubling times of infection rates, Burlington County sits in a different position than, say, Cumberland County. And, whether our situation is going to change or not, it remains to be unseen. Nobody's got a crystal ball on this. But so far, taking Burlington County apart from the rest of the Southern Seven, we are, and surveying and talking to folks over at Virtual, our hospital, they're in good shape. Last time I spoke to them, they had about, only 60% of their hospital beds are filled. Their ER is running about the same, 60% capacity. They have seen, a stable admission rate, maybe slightly declining, and that's a daily thing, but they're stable in terms of their admissions. Other parts of the Southern Seven they're having a more intense experience than we're having right now, which is why you've heard the governor say in the last few briefings that as a region overall, taking all seven together, there's a slight uptick in the admission rate in hospitals. So, but the Burlington County portion of that, we're not driving that increase. So whether that remains so as we move forward or not is anybody's guess. I'm hoping that that will at least stay flat and start to see a decline over time through the summer. But as I say, watch out for the fall, because we could have a double whammy this fall, which could be very concerning. The hope is that all of this talk, quite right, messaging, I should say, on hand washing and social distancing and cleansing, sanitation, and other measures will, and I hope a renewed interest and concern by the population in general to get their flu vaccinations done at least. And hopefully we get lucky. The flu seasonal flu won't be particularly bad, I hope, and that the vaccine that's made on the spot to deal with seasonal flu is very closely as effective as it can be. So if all those things go well, things hopefully will be better in the fall than is right now predicted. But so far we're holding pretty well. I don't believe we've had any diversions here, at least in Burlington County. I can't speak for, I sort of listen more closely to the Burlington County ones than I do to the rest of the region. But so far, we're doing all right so far. I had a lot of concern about cross traffic out of Philadelphia. A lot of people were fleeing New York into the Philadelphia region, and there was a concern that we would get a spillover here in New Jersey. We probably had some of that, but not too much. And so, we'll have to see. But we just have to keep uppermost in the minds of the public that they need to be thoughtful and prudent in their activities. Now, I didn't get around to all the parks. I drove by one over the weekend to see how the traffic was there. I have to get a report. I've got a call this afternoon with the parks person to see how we did in our county parks. I went up to check in on my dad, and just driving through Bordentown. There were kids all over the place, many of them without helmets, unbelievably. Well, not maybe I should say believably, but there was a devil-may-care. Great weather. We've got to be. I'm very concerned about what happens with the beaches. These pictures you saw out of Florida and California. I mean, people were flopping around the beach in close quarters like harbor seals. I mean, this is a recipe for. I don't want to use the word disaster. I don't like the kind of hyperbole, but it certainly is a recipe for advancing the prevalence of coronavirus, not pushing back against it. And I have a lot of concern about what's going to happen along the beaches this summer.
Assemblyman, you talked a little bit about vaccines. I know, but before this all happened, there had been some controversial legislation regarding vaccine. Do you, and there's been talk about that legislation coming back. Do you see this, the COVID pandemic influencing decision-making or a different result in that legislation?
Well, I can only hope that those who failed or refused to join our effort to tighten up this part of our health security net, if you will revisit that refusal as we go forward. We all, I hope that we will sooner than later find that coronavirus 19 will be among the vaccine preventable diseases, and that given the seriousness of it and how easily it spreads, that people will use that vaccine. I have to say that given the really pervasive, and I will use the word lying, that surrounds the vaccine program, I am fearful about the entry of this vaccine on the scene. It's got to be as vetted as well as we can, because people are lying about vaccines that have been proven over and over again to be highly effective and safe. I can't imagine what the conspiracy theorists and those who think, those of us in public health, I guess, are trying to kill people, I guess, will think if we have a vaccine that is not only, it's one thing if it doesn't work as intended, and obviously I hope that's not the case, but it's another thing if it has side effects or not discovered in the clinical trials process. So I am, for as concerned as I am that we develop a vaccine, I'm actually leaning, I'm actually more concerned that we take all the time we need to get the vaccine right so that we don't, you know, put further fire under the people who are prepared to say anything to prevent a working vaccination program.
Very good. The I guess one more question about you mentioned this a little bit in terms of nursing homes. In terms of hospital capacity, obviously we had to recommission some facilities, and there were some pop-up hospitals. You know, years ago there was talk, I think, in the Reinhardt Commission report years ago of overbedding in New Jersey and it leading to higher costs and so forth. Any thoughts about, in a hopefully soon post-COVID world, how to maintain flexibility and capacity in the system? You know, you know, you talked about you know, PTE and so forth, but is there PPE? Is there but larger facilities? Is you know, thoughts about how to refashion our healthcare system to make sure that we have capacity in the event that we need it?
Well, you know, resiliency is one of the cornerstones of our, you know, pandemic response in the future, and you know, how that's obtained, where that should be, are certainly the questions. Do you take an older structure and continue an operation, you know, sort of reopen, or have sort of mothball those in many cases many unused floors or wings in older hospitals that, you know, haven't been able to modernize as other hospital systems have. You know, that's one of the questions going to be answered. We can stand up new facilities pretty quickly. Should we rely on that? But I tell you that the issue, excuse me, that we really need to think about is the manpower and personnel. You know, part of the reason you have an issue in nursing homes is that they're often understaffed. The people who work there are underpaid, and you have a situation that we are currently facing of having a lack of personal protective equipment for the underpaid, under-resourced staffing that you have in these institutions. So, you know, whatever solution is brought to bear in terms of space and any regulations that might be put in place with respect to being able to cohort, and whether it be for adenovirus that springs up as it does from time to time, or Legionnaire's disease, that's more of a building structural problem, but or a pandemic, or serious flu, any of these viral syndromes that will, you know, or scourge of mankind, they're going to be present in the future. A future nursing home, if one is built and that's built, what should their physical plant look like? Should there be regulations about how they're going to cohort those patients in the event of a new outbreak, or God forbid a pandemic, which we know is coming? But should that be in a particular institution, or should we have regional centers that can be opened up to handle patients that need to be cohorted? Does that make sense? You know, so there's a lot of thinking that's going to have to be done with respect to that. You know, the older institutions are supposed to have shared arrangements so that if they need to move patients, you're going to need a command and control system for that. And again, you're going to have you know, you're going to have to be as well staffed as you can, and to be well staffed, you're going to have to pay people well to do that, and you're going to have ready stockpiles of PPE here locally, and a federal government who's prepared to respond quickly to marshal its resources to send PPE where it's needed. And that's not to everybody, clearly. The Northeast and the West Coast were at the point of this thing. They had to be first in line for this equipment ahead of, say, you know, a state in the middle of the country. But you have to have a command and control system, one, to recognize and plan, to be ready to respond. I'll just leave that to one side. And then the ability to, in fact, move equipment where it needs to be. Our purchasing you know, that these states are competing with each other and being bid up is obviously a great concern to those of us who are out there trying to figure out how to get hold of PPE. And our procurement staff has been working overtime. We really would be in a real pinch without them going out there and trying to find something that is that doesn't represent a pie in the sky or out and out fraud, which is pervasive at times like this always. You know, these are big questions, but you know, the nursing home space is going to, and how we manage that as a regional operation or a localized operation within the nursing home, how they should be built, how they should plan, what their capacity should be, how they help with outflow from hospitals as people are in a phase of recovery. Where do they go? And we have field hospitals for that. But, you know, there's a lot of planning that needs to be done around the movement of people through various aspects and suites in the healthcare delivery system. Nursing homes are a big part of that. And I look forward to involving myself in the planning as I'm asked, and to listen to the advice of people, the many people who know a whole lot more than I do about it. So with that, I'll end on that question.
Well, Assemblyman, we really appreciate your generosity with your time and your thoughts. And I really appreciate you coming to do this with us this morning. And with that, I will hand it back to Christina.
Thank you so much, Warden. Assemblyman, thank you so much for joining us. This was a really great conversation. And as I mentioned earlier, of course, this is our first virtual health issues committee. Now that we've, you know, knocked our first one out of the park, we're going to be looking to do another one in June. So please stay tuned for some information on that. But again, I do want to thank Assemblyman Herb Conaway for being so generous with his time today and for answering the questions of our members during, you know, such an uncertain time for so many folks. We truly do appreciate it. I just want to conclude by again thanking all of our sponsors: Horizon Blue Cross Blue Shield of New Jersey, AmeriHealth New Jersey, Inspira Health Network, Ascenda Integrated Care, Fox Rothschild LLP, and We Work for Health. As I mentioned, please stay tuned for information about our next meeting that we are looking to have in the month of June. And as always, please keep your eye out for the survey we'll be sending you after the program does conclude. We'd love your feedback on how today's program went. With that, I want to thank the Assemblyman again. Thank you, Ward, as always, for all of your help and doing a great job moderating the conversation. Everyone have a great rest of your day, and I'll see you online soon.